In adult chickens, blood is most commonly obtained from the brachial vein in the wing. To collect blood samples, you will need the following supplies: disposable gloves and appropriate attire, 3 or 6 ml syringes, 20 to 25 gauge needles, cotton swabs or gauze, 70% alcohol, a supply of blood collection containers, such as Eppendorf SafeLock micro test tubes or vacutainers, and a pen or waterproof marker. Place the chicken on a steady surface, like a table. Using your non-dominant hand, place your middle finger along the chicken's spine and place your other fingers under each wing. Lift the chicken by the wings and grasp both legs in your other hand. Turn the chicken on its side with the legs facing you. Lay your arm over the neck and press it lightly against the table. Expose the brachial vein, located in the ventral humeral region. If necessary, you can pluck a few feathers to improve visualization. The vein is located in the V-shaped depression between the biceps and triceps muscles. The tendon of the pronator muscle should be visible running across the V. Disinfect the area by wiping it with an alcohol swab. Use your thumb to stabilize the vein and apply pressure to distend it with blood. You will use your dominant hand to bleed the chicken. Pull back on the plunger to break the seal. This will help prevent the vein from collapsing when you withdraw the blood. Rotate the needle so that the bevel is facing up. Insert the needle through the skin, parallel to the vein, with the needle pointing toward the tip of the wing. Slowly reposition the tip of the needle until you see a flashback of blood appear in the base of the syringe. Gently pull back on the plunger and slowly fill the syringe with blood. Avoid excess suction, as this can collapse the vein. If blood stops flowing, rotate the needle to move the beveled opening off the vessel wall. Collect 3 to 4 milliliters of blood. If a hematoma develops, remove the needle and try again on the opposite wing, using a fresh needle and syringe. Once finished, withdraw the needle and apply pressure over the puncture site until clotting occurs. Be aware that chickens are prone to developing hematomas no matter how careful you are. If desired, you can transfer the sample to a blood tube or other container for storage or shipping. First, remove the needle from the syringe to prevent hemolysis. Then, transfer the sample and discard the used needle and syringe properly. Lastly, make certain that all the tubes are properly labeled with the pertinent information, such as farm name, flock number, and date.